California is a garden of Eden, a paradise to live in or see. But believe it or not, you won't find it so hot if you ain't got the do-re-mi.
One of the things we need to do is we need to amend the initiative process in California. A couple of things that we could do on that is stop paying people to collect signatures. If you simply did that, if you said that you have to have volunteers to collect signatures to qualify initiatives for the ballot, it would solve lots of things. We wouldn't have Proposition 23, which is going to block the implementation of the California Global Warming Solutions Act. I suspect we would have Proposition 19 that's going to legalize marijuana, but the initiatives that are sort of backed by special interests would be unlikely to qualify. We also need to raise the number of signatures that are necessary to qualify for an initiative, because it's pretty low right now. And we need to have some way of vetting them for constitutionality, so we don't have situations like we're not going to let children born in the United States of illegal immigrants go to school that then gets tossed out by the courts.
Californians took a step forward in November 2010 when they passed Proposition 25, which restores a simple majority vote to pass a budget and docks legislators pay for every day the budget is late. But then voters took a half step backwards by passing Prop 26. Funded by oil, alcohol, and tobacco companies, Proposition 26 adds a 2/3 majority requirement for state and local governments to impose fees on businesses that harm public health or the environment. Because it is retroactive, Prop 26 took a $1 billion bite out of our recently passed state budget that will have to be balanced by more cuts. Squeezed between a budget deadline and the inability to raise revenue, legislators have no choice but to keep on cutting, speeding California in its race to the bottom in per capita spending for health, education, and public safety. We need to go back to the polls and finish the job we started by eliminating 2/3 requirements to raise funds and reverse tax cuts so that corporations pay their fair share.
Better stay right where you are. You better take this little tip.
Another suggestion is to amend or repeal term limits. Now, I know a lot of people are in favor of term limits, but at least to make the terms a little bit longer so that they're not quite so outgunned by the lobbyists. And essentially, I think what we really need to do is we do need to push for a constitutional convention to look at the California Constitution. There was a study that was done by the legislature in 1996. They worked very hard. They came back to the legislature to tell them all of the things that they thought needed to be changed. They delivered their report to an empty chamber. Again, I think lunch was on the menu. And no one did anything about it. So we need to have something that generates the perception on the part of the California voters that some significant structural change needs to happen.
Unless we're going to start printing our own money, we'll have to do something about health care. 30% of the general fund goes for health spending, and about 1/3 of that is wasted on administration and profiteering that would be eliminated by a single-payer system.
There are people who get some health care services because they're young. There's people who get some health care services because they're old. There's people who get some health care services because they're poor. There's people who get certain health care services because they have a particular disease or disability, and there's actually quite a long list of those diseases and disabilities that have special categorical programs laid out for them. One of the things, though, that you discover if you dig into it a little bit is once you create a categorical program like that that's designed to serve a particular group of people, one of the things you have to do is to decide who does in fact qualify for the services provided under that program, and you discover that typically in one of those programs on the order of 20% or so of the budget for that program goes simply into that process. And that's kind of symptomatic of the problem with a lot of our healthcare system in America.
Even more money is wasted on health benefits for state workers and retirees. with over a third of every healthcare dollar in the private sector wasted on bureaucracy and profits. Economic analyses by government agencies and independent analysts have repeatedly shown that single-payer is the only type of reform that can significantly bend the cost curve and actually decrease total health spending.
Our research arm did a very substantial study that showed that for less money, we could get more results by spending a portion of that money on creating a single-payer healthcare system, that it would stimulate more economic activity, produce more jobs, and in the process get everybody covered for healthcare needs. So a big part of the way that we can grow the economy in the way we need to, a big part of the way we can get people back to work, is through addressing those healthcare needs. And back in 2005, a very respected group, formerly very respected organization called the Lewin Group, which was a very good independent healthcare analyst. That company has now been bought by a health insurance company, so anything they produce locally can be ignored, anything they produce lately. But things they produced back a few years ago were some very good work. And here's what they came up with for California, just focusing on, okay, what would happen if we passed this bill in California and put it into effect? And what they came up with was that it would save about $20 billion a year in administrative costs. That's administrative costs within the insurance industry, within doctors' offices, within providers, and so on. It would save about $5 billion a year through bulk purchasing, about $3 billion a year through improvements in preventive care and things like that. Then an added cost of about $23 billion a year for covering those people were uncovered, with a net savings of in excess of $5 billion a year in terms of total savings in order to get everyone covered. That's covering everybody who needs health care. We would end up with less expense for the state of California overall. If we had done that 5 years ago, the net savings between then and now would have totaled around $40 billion a year, somewhere in that neighborhood. So just kind of a little snapshot of where we are in healthcare as a country and as a state is that if you look at the cost of healthcare in America, I don't have the very latest data, but basically our per capita spending as a country on healthcare is somewhere in the ballpark of $7,000 per person per year. That's for everybody, all ages, all stations in life, everything like that. About per capita, 7,000 plus per year. Roughly, if you look around the world, the next most expensive country spends about 60% of what we spend. Most other industrialized countries in the world spend on the order of half of what we spend. Many countries manage to do quite nice healthcare systems, spending as little as 40% of what we spend. So there's quite a lot of variation. We stand out strikingly as the most expensive healthcare system in the world. And it's pretty dramatic how much more expensive we are than all of those other countries. As I said a minute ago, about 60% is roughly, the next most expensive country spends about 60% of what we spend on healthcare. Interestingly enough, if you look at how our healthcare spending is funneled, what we already do through tax money, what we already spend through the public sector in healthcare, is just about 60% of healthcare spending in America. If you boil that all down, if you compare what we're already spending through tax money and what all the other wealthy industrialized countries in the world spend, you could basically say that we're already paying for universal health care in this country, we're just not getting it.
We're working on getting the word out there. Now I know that someday we will have universal health care in the United States. We will have Medicare for all. And it may happen when I'm dead and gone, but it will happen.
California is a garden of Eden, a paradise to live in or see. But believe it or not, you won't find it so hot if you ain't got the do-re-mi.